Hi, good evening. I'm Fami. Welcome to another conversation with me today. We're here to talk about Ascariasis nobicoins. Ascariasis nobicoins is a worm that lives in human stomach. You usually get it when they eat infected food or contaminated water. And you actually get this when you do not wash your hands after using the toilet. So you get once it gets introduced into your body, you get an infection known as Ascariasis. Usually, it is very common. It's a common parasite among locations where there is poor sanitation. Sanitation of the environment where you are is where you can have a high risk of getting exposed to this parasite. Other signs and symptoms, we have the mild cases. Usually the mild cases has little or no symptoms, but for the moderate to severe cases, you have symptoms like nausea, vomiting, abdominal pain, intestinal blockage in an extreme situation. You can have cough. If these parasites have found their way into the lungs, under diagnosis, we have imaging, abdominal to chest x-rays to check the presence of the swarm, and there's also lab tests, and then there's stool tests, to check for the presence of the worm in the stool, and then complete blood counts. For physical examination, which is still under diagnosis, you can check for abdominal tenderness, and for clinical presentation, you have to note that abdominal discomfort, visible worms in stool or visible worms in cough when it has been introduced into the lungs, fever. These are some clinical presentations that you use to know that Ascariasis. For differential diagnosis, we're talking about symptoms or ailments that mimic Ascariasis. Here we're talking about appendicitis. For appendicitis, we have something similar, which is abdominal pain. But for abdominal pain, you should know that for appendicitis, you don't have worm or eggs present in the stool. So that's the distinctive feature. Also, hookworm because of the anemia, and you know that Ascariasis is linked with low nutrition or malnutrition. So anemia is also something that is a feature. But as always, you're not seeing worm in the stool or eggs of these worms in the stool of the patient. Other causes and risk factors, it's usually caused by ingesting Ascaris eggs into the body. So you can get it via contaminated food and water, like I've explained earlier, and poor sanitation or poor hygiene. Then when we talk about treatments, the drug of choice are usually antiparasitic drugs, mebendazole, albendazole, ivermectin, and the likes. Other management that are not drug related, we talk about hygiene, and nutritional support to boost your immune, to be able to discard these worms and not bring down your immune system or bring you down with anemia or some of this. For prognosis, you should know that complications like lung distress or issues and then bowel obstructions may occur in severe cases. And it's very important for you to know that reinfection will occur if hygiene is not improved. So the summary of it all is make sure you improve your hygiene, make sure you improve it, and make sure that your surrounding is clean. After using the toilet, you should wash your hands and ensure that you keep your hygiene space to avoid reinfection even after treating Ascariasis. Thank you so much for listening. I remain Fami. See you in the next video.